Hey there, it's Chris Hogg here, and we are live at Inventures, and I am sitting down with Sameer Dhar, the CEO and co-founder of NiaHealth. Sameer, thanks for joining us.
Thank you for having me.
So you've just come out of stealth, or recently, and I want to come back to that, but tell us just off the top, what is NiaHealth? What are you building?
We're trying to make top-tier proactive health accessible to the masses, so to as many as Canadians as possible. Right now in the primary care system today, less than 3% of physician time is spent on prevention. And if you're wealthy, you can spend $2,500, $3,000 for an executive health assessment and get access to a lot of the best-in-class insight. But we think that at NIA that best-in-class care should be available to more than just the wealthy. So our plans start at just $299 for a next-generation checkup. Last thing, on our checkups are based on blood, all of them. So we'll send a phlebotomist to your house or office, screen you for up to 50 biomarkers, and between your medical history plus those biomarkers, we'll tell you where your biggest risks to health span and longevity are and what you can do to get in front of that risk. On top of that, we also add a whole bunch of other advanced diagnostics, so VO2 max, DEXA scans, gut microbiome, etc.
So for those who are interested in learning about preventative health, you're physically deploying someone to their house, drawing blood, goes back, gets analyzed. There's a tech product underpinning all this?
Correct, yeah. So you'll get all your results in a next-gen dashboard online, which you can actually use to track your results over time, so you understand, hey, if I actually action some of these recommendations,
you can see change.
Am I reducing my risk? Yeah, over time. And so our vision of the future is a world where healthcare is owned by the individual, and you can actually be empowered with information to make decisions around your health versus,
So you woke up one day wanting to solve a big problem here. What was the inspiration?
So in a previous life, I built and sold a company in the elder tech space. So we built a sensing solution for, of all things, incontinence management in nursing homes.
Okay.
And as part of that journey, I actually physically lived out of nursing homes for 12 months across North America. And seeing what life can look like at the end kind of inspired me to say, hey, as worthy a cause as any is figuring out how to keep people healthy as long as possible. And so that's kind of, for me personally, the impetus behind building NIA.
So I want to come back to, you built in stealth a year and a half, if I'm not mistaken.
Yep.
What was the choice to build in stealth? So you didn't go public. You didn't do the big startup, rah, look at us. Why was that the path?
So for us, we believe that we want to base our product in first principles, make sure that we built a really good product experience, and stayed away from the hype, focused on building an evidence-based product. And then once that was working and that we started to see momentum from a growth perspective, we thought at that point it made sense to come out of stealth and share with the world and Canada in particular what we're building. So
practically for other founders though, how do you get the word out when you're in stealth?
Yeah, so I mean, I think it started with the founder hustle of finding your family and friends as first users. But if you're building a good enough product and if you create an experience that's special enough, I think that an important part of the equation for us is product-led growth. And so they start to attract their friends that are relevant, and then your ICP becomes more and more defined, and then you can throw fuel on paid marketing and other marketing channels after that. But I think it's really important to first focus on the first principles and get that right first.
So from a high-level perspective, are you approaching this like the science of looking for these markers? Are you doing something different, or is this you're just productizing it, making simpler, and it's access that you're trying to fix?
Yeah, so it's more the latter, although it's unique because in every geography you're in, so in a Canadian context will be different from the U.S. or an American's lived reality when it comes to experiencing healthcare. So Canadian guidelines differ from every other geography. So what a person actually gets access to in the Canadian context versus the US versus any other OECD country or any other country for that matter in the world, completely different. So I think, productizing the best available science and then interpreting people's risk based on that best available science, that's core to who we are. And that's why we've always invested in a clinical research team to understand from the literature directly what makes sense to test and how to interpret that risk.
What about the security? Like, you're asking people to give up some pretty sensitive information, and the return on that is clear to me, or I could see why people would want to know that. But there's also been coverage of healthcare startups that come and go. So how do you protect data, and how do you talk to people about handing over some pretty sensitive information?
Yeah, so I mean, we've spent a lot of time on privacy and data security from the very start of the journey 18 months ago. So we do not sell any, and nor will we sell any data to third parties.
Yep.
We don't actually share your information with insurers or even the public system for that matter. So our vision of the future and of the world has to be consistent from a data security and privacy perspective, where we're saying to you, hey, we're going to empower you with your own data, but then it's you who gets to decide what you want to do with it, if anything at all. So that's the world that we're building towards, and integrity is my personal number one value, and something that I think the company espouses as well.
So coming out of stealth, or when you started beta testing, like how many tests have you done, or what kind of scale to figure out how to make the product work?
Yeah, so I mean, we're now serving thousands of customers across the country. Within a few weeks, we'll have coverage across 85% of the Canadian population. So
Wow.
every province other than Quebec, which we will get to eventually. And I mean, some interesting stats are 90% of folks who go through their first checkup experience with us discover some sort of a health indication or risk that they didn't know about before, including 20% flagging for genetics-driven cardiovascular disease risk, 25% flagging for prediabetes or diabetes that they didn't know about before. And I think the exciting part is, beyond just flagging the risk, they're now all on plans and taking action to try to reduce that risk over time.
Preventative health or preventive health care is often discussed, but it's really hard to adopt at scale. Are there lessons learned, or are you approaching this differently to try and overcome barriers of those who've come before?
Yeah, so I think that's why it's super important to be technology enabled. So we believe in a future with clinicians in the loop. We don't think that AI, for example, is going to replace everything that clinicians can do. But we do think that AI and other, logic models, et cetera, will help a clinician deliver better care and far more efficiently. So to your point about scale, being tech enabled with these standardized panels allows us to very efficiently capture a person's risk at scale in a way that the system right now, the way it's set up, where you requisition individual markers based on an individual risk profile, based on Canadian guidelines that, it's tough to translate at scale across 50,000 physicians in the country. There's just so many barriers to driving access to top-tier proactive health at scale, which I think from a tech-enabled perspective, making that happen is much more feasible.
Public-private healthcare is a big divisive issue in Canada, and you've talked about complementing healthcare, not competing with it.
Yeah.
Do you want to unpack that a little bit for us?
Yeah, totally. So for us, we take our duty to the system and to Canadians as a whole super seriously. We honor what the public system is meant to do. And what it's set up to do is to actually deal with a reactive model of care. If you've got acute illness or, an emergency situation, I think we do a relatively good job as a society of protecting those folks who have those situations. But if we talk about empowering a whole new way of delivering healthcare in a preventative way, that's where we see our role, because we can help a person flag their risk early, and if there is follow-up required through the primary care system, we're going to give you a letter as a starting point that summarizes, here's what we found, here's what we're recommending as next steps, and that's based on Canadian guidelines. So you as the user should feel empowered and educated to be able to go into your primary care provider or a walk-in clinic if you don't have one and go get those follow-up next steps. We found that to actually be fairly successful in our first several thousand users. I think the challenge always is sometimes you have providers who aren't happy taking results from a third-party provider and actioning them, right? So, but again, that part of how we mitigate that is we do offer clinician consults as part of some of our offerings, where people can get better educated on their risk profiles and get some of the follow-up care that they might need through the public system.
So I don't know if there's one answer to this, but if I'm someone that wants to try and go down this route, what are the things that you can detect? Like how broad is the range? I imagine some people have to get over the mindset of, do I want to know this? And then maybe wrestling with, of course I do. But what kind of markers? You mentioned diabetes. You mentioned
cardiovascular
disease. What
else?
Yeah,
we look at all the major kind of health risk areas. So whether it be kidney and urinary, metabolic, cardiovascular disease risk, bone, and more. And so the key thing for us is get as comprehensive a view as possible. But the markers we test, we're very cautious about making sure that the insight we can get from testing those things will actually be useful, as in you can actually take a next step from it. We, for example, do not test ApoE4 right now, which is a genetics-driven marker for developing Alzheimer's disease, partly because we don't believe that the literature is robust enough around what can you actually do with that information, and then how do we make sure that we have the proper counseling, et cetera, in place to help you deal with whatever the outcome of that type of a test is. So for every marker that we test, we go through a very, very rigorous process to try to, of which one of the key criteria is it actionable? Can the person actually do something about it? Otherwise, why test it?
I'd love to end with some of the founder thoughts. So outside of just the product you're building, you had an exit, you've built previously, you're doing NiaHealth now. What have you learned? Like, are you doing things differently now as a CEO?
Yeah, I think one of the key takeaways for me on this next journey has been it actually feels remarkably similar from a feeling perspective as the first journey. It's just as difficult. There's a whole new set of challenges and circumstances that you're dealing with on this second journey that you didn't deal with on the first. I think objectively from the outside, you're making a lot more progress a lot more quickly. But the feeling wise, it's remarkably similar. And so from my own personal growth perspective, I think one of the things, one highlight for me in the past two journeys has been, in the first journey, it was intense. It was super all in. You were living at nursing homes together with.
That's a big commitment.
Yeah, it's a huge commitment. And honestly, a lot of that is still applied within the NIA context. I'm still concierging all of our customers' experiences because I think being close to your user is super important. But I think it's having a bit more wisdom and being able to take a step back and realize that, hey, you need to create a sustainable model at the same time, one that doesn't necessarily burn out yourself and the rest of your team, so that we can collectively make a big impact over time.
And where are you focused now with growth? Is it product, user adoption, like all of the things?
Yeah, I think marketing, go to market, and continue to focus on product-led growth and retention. Those are the two.
Are you in the US yet?
No, we're just Canadian.
Focus on Canada first?
Absolutely.
Great.
Yeah.
Sameer, thanks so much for joining us.
Thank you for having me.
For more information on this and how healthcare is adapting, visit digitaljournal.com. Thanks for joining us.